Well, it's important to know this isn't the first time that they've had trouble with spring break in Miami Beach. It's been a problem for the last few years. And in fact, they've brought in special police trucks in the past. But we do know that Florida is one of the few states with almost no restrictions statewide. In fact, Governor DeSantis has made it illegal for local jurisdictions to require mask wearing. What local jurisdictions can do is they can limit the number of people in establishments as long as they make a public health case. So it's not surprising that this happened during spring break in Miami Beach.
Kate, the vaccines are coming online. There's a bigger rollout, but we're also seeing travel. Air travel is up. States are relaxing restrictions. Are Americans, taking their guard down too soon?
I think it's going to be a real race. As we just heard, there probably will be the AstraZeneca vaccine approved in the U.S., so we'll have 4 vaccines. But we know that the more catching variants are spreading in the U.S. And so you have a combination of the letting of the guard down, the lowering of the restrictions, people traveling more, people going out and seeing their friends more. So even though more people are vaccinated, there is this concern that we will see a spike in cases. And it's certainly been flat for the last few weeks, which is worrying.
I do want to follow up on this AstraZeneca vaccine. I mean, yes, the study is now saying that it's 79% effective, but we've seen, sort of the reports of blood clots, and so just confidence is dented. Is this enough to calm fears?
It should be. This was a phase 3 clinical trial that was carried out in the U.S., and they did not see any increased blood clots in the group that received the vaccine. So I'm hoping that this will give the Europeans and other countries the trust that they need to restart vaccinating their own population. Because as I mentioned, it really is a race against time between the more catching variants and vaccinating the population.
Talking about national speed and the rollout, how is the U.S. going towards its goal of vaccinating every adult come May?
It's actually doing very well on a number of different measures. The U.S. has vaccinated more people than any other country in the world, and now American adults are saying, more of them are saying they want to be vaccinated. The number is up to 77% of American adults being willing to be vaccinated. And when you think of the fact that probably over the summer, we're going to get the results of the phase 3 clinical trials on children, we'll hopefully start vaccinating children in the U.S. And so I actually think the U.S. will need that AstraZeneca vaccine to not only vaccinate all the adults, but all the children who want to be vaccinated. And as I think one of your reporters mentioned, the Biden administration has a goal that by May 1st, all states will make every adult eligible to receive the vaccine.
I just want to very quickly get your sort of impression, because all the headlines seem to say, there's a new wave here, there's a different spike in different parts of the world, and we're just seeing new numbers come in India. Are we really just in one big wave that's never quite subsided?
I do think there have been a number of different waves driven by different factors. And I think what's driving the current wave is the new mutations, the new variants, but also just the exhaustion and the COVID fatigue that more and more economies are opening up. Like, for example, we saw Dubai has now started in-person meetings in their convention centers. And there's no doubt that this type of reopening will indeed cause spikes.
Dr. Kate Tulenko, always good to speak with you. Thank you.